If you want to know all of the content for your medicine interviews so that you can be studying medicine at your dream university next year, then this is the video for you. In this video, I'm going to be talking about privatisation of the NHS and how you can talk about this in your med school interviews, as knowledge and understanding different hot topics is really important to aid you in doing well in your med school interviews. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position, but fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140, and I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalised support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalised, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Currently in the NHS, healthcare is free. The reason for this is because funding often occurs through general taxation, national insurance, and sometimes through small amounts of prescription costs. However, something that has been increased in talking about is the idea of privatisation of the NHS. What privatisation would mean is that the NHS as an organisation, instead of being able to offer free healthcare to everyone, instead it would have to commission its services to other groups or to other companies, and people would either pay through a form of private insurance or individually. This would mean that instead you have to pay for clinical needs and to access healthcare. Even now, the NHS does have partnerships with other external companies that provide their services. However, this is often paid for by the NHS. Individuals do not have to pay to access different healthcare services. What privatisation would mean would that an individual or private insurance or some other form of payment would be needed by an individual in order to access these different healthcare services. This means that other companies would often be commissioned within the NHS to provide these services, and a lot of care would be distributed or given across to different organisations. In terms of the impact that privatisation could have, first it's important to consider the impact on patients. This may mean that certain patients may be less likely to come into healthcare scenarios or into healthcare settings because they're worried about having to pay more in order to actually be able to access healthcare. Additionally, the impact this could have on healthcare professionals who actually work in the NHS, although research has shown for it to be a little bit unclear, it is important to consider that healthcare may become more fragmented. The reason for this is because if the NHS becomes privatised and different healthcare services are commissioned out to different organisations, it means that navigating multiple organisations or managing systems between different healthcare companies within the NHS could become more difficult. And in a survey conducted by the BMA, 2/3 of doctors stated that they would be uncomfortable with the idea of privatisation growing within the NHS. When you are asked about privatisation within the NHS as part of your med school interviews, you do not need to pick a side saying yes, definitely, or no, absolutely not. What you need to instead do is create a balanced argument talking about what are some of the reasons that privatisation could be beneficial and what are some of the reasons that it might not be beneficial. You have to show that you can weigh up these different arguments and discuss, and then at the end you can either offer a compromise solution, or if you would like to, and if you backed it up by reasoning, you could pick one of the options. But it's really important to make sure that you have good arguments and reasoning for the reasons for and the reasons against. Some of the arguments in support for privatisation of the NHS include that it may actually alleviate some of the pressures on the NHS, such as the really long waiting times that have occurred, especially since after COVID. Additionally, as the NHS would be privatised, this means that there should hopefully be more money to be circulated. This could then be used to be put forward, for example, for the doctor's salary supplementation, or even to be put forward for medical research. And this research actually could be life-changing and really beneficial for different conditions. Additionally, privatisation could give patients more autonomy, as patients have the choice in which treatments to participate in, or if that they do want a specific treatment, they can actually decide to opt in for it instead. Additionally, it's important to note that privatisation privatisation of the NHS could result in a reduction in the waiting times. Reason for this is because if the NHS is privatised, it means that there may be less unnecessary visits to the doctor or hospitals. What this means is that sometimes a patient may not necessarily need to go to a GP appointment or to a hospital appointment, but instead could receive the same level of care for example, a phone call consultation or going to a pharmacy, because these are not as serious of problems. However, there are also many negatives for privatisation of the NHS occurring. The first is that it doesn't value the ethical pillar of justice. Now, justice makes sure that everyone will receive equal care. However, if the NHS does become privatised, this may mean that certain groups in society or different people may not actually have access to healthcare as easily due to that cost barrier. This could actually exacerbate current issues in the UK, where there already is a disparity between different areas which have access to healthcare. Additionally, individuals who may have a chronic illness or require more healthcare could be negatively impacted because they have a greater financial cost in order to actually be able to access healthcare services. As mentioned, privatisation of the NHS could have positive but also negative implications. You need to be able to discuss all of these different arguments that I've mentioned throughout the video within your medical school interviews. If you can discuss these different points, understand them, and talk about them in a critical and analytical manner, this will really help you into securing your offers. If you want to learn more about the NHS hot topic so you can secure your 4 out of 4 medicine offers, make sure to check out the rest of my channel.